were a little bright there. Johnny, can you adjust the brightness there? I feel like I'm under the radioactive sun.
White shirt says radiate.
Yeah. Well, welcome back to Tom Bullock Chevrolet's morning show here at WHIG TV. We're here with our segment this morning on elder care, in case you didn't see the loop that went by for 5 minutes. Ed, welcome to the show. Appreciate you being here.
Thank you. Good morning.
What is Pruitt Healthcare?
Well, Pruitt Healthcare, we're an entity. We're the largest medical provider in the Northeast. I'm actually the administrator for Pruitt Health Hospice in Rocky Mount. We have skilled facilities, home health throughout 3 states. But we cover most of the counties out to the east in North Carolina.
And y'all used to be United Hospice.
We used to be United.
So a lot of people may know you from that.
That's correct.
All right.
We changed our name so that all of our companies would be named the same.
All right. Now, there's your company does a lot of services, and a lot of people think hospice is usually associated with like one particular aspect of life and death.
Right.
Can you explain what hospice is so people have the broader picture?
Well, hospice is a service that is provided to people when they are at end of life. They have to have a terminal diagnosis. A lot of people think of hospice as Aunt Betty was put on a hospice. She died 3 days later. So when you mention hospice, a lot of people, they just kind of get freaked out. What I like to tell people about hospice is that hospice doesn't always mean that you're going to die tomorrow. If you get on service today and you die tomorrow, then the doctor has waited way too late to put you on service. It's a great service. It can provide a lot of comfort and support to people. We provide comfort and dignity at end of life at home or in a facility or wherever it is you reside, which would be your home. We have all different types of services. I know a lot of times when a patient or has been diagnosed with a terminal illness, we can come in. We have medical social worker, chaplain, I have CNAs, volunteers that can come in to help you stay where you're at, wherever that may be. A lot of people think that if you're in assisted living or a skilled facility, you can't not have hospice, and that's not true. You can have hospice anywhere that you might be. It's the social worker can come in. We do a lot with advanced directives to kind of help you to understand end-of-life decisions and to help get things in order so that things go where you want them to when that time comes. To also help with funeral arrangements. We have social workers, chaplains. Chaplains come in for spiritual support, give emotional support. Our volunteers can come in and sit with someone so you can get out of the house, go visit somebody, go to the grocery store. And then we have CNAs that can come out and can give a bath. They can sit with somebody for just a little while if they need to. They don't do heavy housekeeping, stuff like that. But then, of course, you have the RN that comes out and she assesses at least once a week. Usually when we start coming out, we'll come out a little bit more often at first, and then we'll kind of drop back if everything seems like it's going pretty good, and maybe come just once a week. Then as time starts progressing, then the nurse will come out 2 to 3 times a week, and then if it looks like somebody's really starting to make some decline, then we'll be out every day. And so with the social worker, so that we give that support they need.
Well, that also helps with the loved ones, give them a little bit of a break, because they
Right.
tend to do a lot of the heavy lifting, the main care. And so when hospice arrives, it allows the family members to not necessarily take a break, but at least to be able to step away for a little bit, take care of their own life before they have to come back and get re-involved.
Right. And some things that people don't realize too is that there are other services that they can still have and be on hospice. If someone's on CAP services, for instance, CAP is supplied through Medicaid to help keep somebody at home versus going into a nursing home. A lot of time hospice can come in if they have a terminal diagnosis, because we do help pay for things like medications, DME equipment, and the nurses coming out. So that's money that is saved that's coming out of those CAP dollars that can be spent for something else,
Right.
whether it be extra CNA services or whatever it is that they need to stay at home. Another thing that's new that actually started January 1st is that we're now allowed to come in when PCS services are involved. And that's something we've never been allowed to do in the past. So, if somebody because a lot of times people have to choose between their PCS service, which sometimes they have a caretaker coming in for 2 or 3 hours a day to help with the meals, the housekeeping, and things of that nature. They were not allowed to have hospice. Well, now they are. So, so anybody out there that has PCS services that has a terminal diagnosis, as an option that was not available, that is now.
Now, a lot of people are also, usually by the time they face hospice, they're also facing the death of a loved one. So they're not always thinking about options and who they can choose in terms of their hospice care. People like to avoid taxes. People like to avoid talking about funeral homes and life insurance and all those things where you think about what you're going to need later in life. Can somebody pre-prepare for hospice services and choose who they want so that whenever something does happen, they can have the service available?
They can. Sometimes there are certain physicians or hospitals that might want you to choose a particular hospice. If you have a hospice that you would like to use, you could let your physician know that this is who you prefer. You can let your family know. It is your right to choose who you want, and so they can't make you take another hospice if you want a particular hospice. So that is one thing. And I like to tell people that you're in the driver's seat. You control, you make decisions. Even when you come on board, you're in the driver's seat. I can't tell you what you're going to do. If there's certain medicines you don't want, certain type of care you don't want, you have a right to refuse anything you want. And you are involved in your plan of care as to what you would want done for you at end of life.
All right.
There are also different levels of hospice. We have routine home care, which is where we come out routinely, see you in the home. And then if you're having some symptom issues, then there are a couple of options. You can have GIP, which is in the hospital. You go in if you're managing symptoms that we cannot manage at home. You go in there, you get them under control, and you go back home. And then there's continuous care, where if you're at home, you don't want to go back to the hospital, and you're having some symptoms at home, we can put some extra help out there to get you through those symptoms, get them managed. Once they're managed, then we drop back to routine care. We also have what's called respite care. So if you have a caregiver in the home that's taking care of somebody, you want to take a vacation, or you just burn out. You need some time to yourself. Yeah. So you can have 5 days of respite, and we have certain places that we can send you to. We can send a patient while you get that 5 days of respite, and then they can come home so you can get a break.
Right. And I think that's important to know, because it can be overwhelming and demanding emotionally on the family and the support system, and so having that service available to be able to help those families cope is an important service. And
I think I'm a nurse, and I've been a hospice nurse. I'm an administrator now, but I know from being out in the field and taking care of patients that to me it's rewarding, because a lot of times you'll get somebody who either they've been admitted too late, and they've been given a diagnosis and they're having a hard time coping, and while this can't be happening to me, doctor says he's only got two weeks left, and walking around as good as you and me, and then the next day they're making a rapid decline, and to be able to get somebody from that point to a point where they can accept it in that short period of time is very rewarding. And it's nice to know that we can do that for people.
Right.
And then by getting, it's really best to get as early as possible, because a lot of times we can get in there. You wouldn't believe how many times I've seen people who actually haven't made any kind of arrangements. You go in and, a lot of people nowadays have separate checking accounts, different properties and their names are not in their spouse's names, right. Or they haven't made wills,
and funeral arrangements or anything.
A lot of times you can go in, when sometimes people are in denial and say, I know that we don't want this to happen, and sometimes people are waiting for God to heal them, and yes, God does heal people, and I've seen miracles, but sometimes it's not in God's plan to heal somebody.
Right.
And so as we see someone declining, a lot of times, especially if I see somebody who's not taking care of those issues, it's a good time to come up and say, you've already built a relationship with this person, you've been seeing them for 4 or 5 months, you got everything in separate names, this is what's going to happen. If you were to pass away tomorrow and not be able to make any decisions, your wife might not have access to your checking account. Your money's going to be frozen. She's not going to be able to pay bills. And so, we help people get to that point to realize who do they want to have their stuff before they die. Because if they don't make those decisions, then
it's made for them.
It's made for them. And actually, their money's going to be froze up.
So it goes through probate, which makes it takes a very long time.
A very long time.
Settled,
so it makes it very difficult. But there's just lots of reasons to have hospice, and that's just one of them. Pain control. A lot of people have a lot of pain, discomfort at end of life, and we can come in and we're experts at pain and symptom management. We're different in a way from home health in the fact that we do use medications. A lot of times we use increased medications that home health usually doesn't use. And also are on call. If you have a symptom in the middle of the night, you're having fever, you're having a lot of pain, generally you're going to have to go to the emergency room. But under hospice, you don't have to do that. The nurse will come out at 2 o'clock in the morning. And sometimes it's just for the family. They're anxious.
And home health, a lot of people think of home health services, but that's long-term disability and long-term illness. For somebody who has got that, unfortunately, has got that final designation that they are going to eventually pass away, that is an entirely different management of health care versus somebody who is long-term sick.
Right.
And so that's an important aspect to think about. It's not just about having a nurse who comes and visits you once a week and make sure you're taking your medicine. It's about caring for the entire spiritual end of life.
Correct. I mean, I can remember a time I went to visit a patient at 2 o'clock in the morning. His wife called me and said he wasn't doing well. I went out to see him. He was doing fine.
She wasn't doing well.
She wasn't.
And I sat and I drank coffee with her until 6 o'clock in the morning because she wanted me to sit down and have some coffee with her. And I left, and a few hours later he passed away. And she said the most important thing that meant anything to her at all was me sitting there at 2 o'clock in the morning because she was so anxious that she couldn't think of anything anybody could have done that would have meant more to her than that. So, I mean, it's just simple things that may not even, that we can do because we're there for the family as well as for the patient. So, and it is family-centered. A lot of times, best friends.
Right.
It's just, and then also too, you may have maybe you have a family member that, or even a friend that you want to make some amends with, that you haven't seen in 20 years, and they're having a difficult time. You come to find out that this is going on, and you can kind of help them make amends there at the end.
Right.
And so there's lots of things that people, they don't even want to tell anybody, but they'll tell their hospice
Things
nurse.
that go unsaid, family members, children, of course, who harbor regrets and ill will, that all tends to kind of melt away at the end of life. So, but sometimes it takes that extra person to help facilitate it. All right. Well, we appreciate you coming on. If somebody wants to get more information on Pruitt Health here in the Rocky Mount area, how can they do that?
Well, they can give our office a call. Our number is 442-9126. You can, because we can come out and talk to you. We don't have to have a doctor's order to talk to you. And then if we can get up with your physician for you, or you can talk with your physician yourself. Let them know who it is you want to provide your hospice care. And we have to have their medical history. We have to have something that has their diagnoses on it, so that there's been lots of regulation changes. The one important thing that I want for people to understand is that when we used to go by a primary diagnosis, and now we go by a prognosis. So it may not be any one particular illness that makes you 6 months or less. It could be a combination of things together. So, and that's a big difference. But they can contact us. They can contact their doctor.
Okay.
And go from there.
All right. Well, we appreciate you being on the show this morning, Ann. Thank you for the useful information.
Thank you.
All right. We'll be right back after these messages with our next guest.